Alright, so what's going on, everyone? Welcome to SurgerySquad.com. It's a website that allows you to do surgery on different parts of the human body, and it kind of just shows and explains exactly how they work. So, just saying for people who are going to be watching this, if you're not prepared, this is kind of what's going to be happening. We're going to be doing two different things. The first one is going to be this one, which is toenail infections. Ingrown toenails are going to be ripping off the nails and everything. So something beautiful. My mom was a nurse back then, and she used to tell me all these amazing things that used to traumatize me as a kid. So I'm going to relive those moments by playing this game. So before you scrub in, surgery is inappropriate, blah, blah. Yep, we know. It's not a substitute for professional medical advice. yeah, who would have guessed, huh? Let's see, ingrown toenail removal. Okay, yep, and that's sponsored. Oh my god, there's in birth. The second one we're gonna see, it's gonna be amazing.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail.
Very true.
An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors.
How does your foot get like that?
There are some ways to treat an ingrown toenail at home to relieve some of the pain. But remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one.
It's funny because I actually saw
our
someone
patient is ready, so let's begin by disinfecting the toe.
Okay. Click and drag the iodine to sterilize the area. Click, yeah, so this is exactly how it works. I've seen someone on YouTube actually do this, and because it's funny to me, it's just like, yeah, you should not do this at home. Dude was doing it at home, he like accidentally clipped something in his toe and just blood started squirting out. He was like, oh! Oh boy, it's on YouTube somewhere, you have to find it. It's amazing. Because we just iron dyes, just a little iron dyes here. It should be in the, well, let's get some right there. I mean, we could do the entire spot, yeah. How about the entire foot? I mean, in areas that don't really need. I mean, yeah, just might as well the entire foot, because we're gonna be touching the foot anyway. So it's like, if you sterilize the entire foot, there's less chance of you actually touching the foot in certain areas, So there you go. The entire foot is done.
Now we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe. Okay.
In the toe? Oh, these areas. Oh, can I inject it anywhere else? Can I inject it here? Oh, okay, I was about to say if I can freaking inject it anywhere. Okay, so we can inject it inside the little pussy spot right there. So let's go ahead and... Ah! Nice. Beautiful. If you guys don't like needles, I mean, back then I used to hate needles, obviously. I remember thinking I was younger. Especially going to the doctor when I was like really young, getting an injection. Oh, I used to freaking hate that. I used to cry like crazy. But now I'm just like, whatever, it doesn't really matter.
Now we'll wait a few minutes for the toe to get numb.
Oh, beautiful music. Oh, man. Cool. Great.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail.
Okay. Just put the, ouch, that sounds
First,
like that hurt.
Carefully slide one blade of the nail anvil under the affected nail.
Oh, okay. Oh, so you just slicing under, right? Just getting a little slice in there?
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
Yeah, let's go ahead and just cut it. Yep. Yep. Oh. Oh, we just dig it in there, you know what I'm saying? Just,
Great. Take the forceps and carefully remove the ingrown nail.
Yep. Isn't there there's flesh under the nail, so we're gonna have to rip off some flesh, right? Yep, definitely ripping off some flesh there. Just, look at it's all stringy. The flesh is all stringy.
It's getting kind of messy in there. Let's clean up that blood.
I'm usually not that, I'm really not squeamish. I just like to yell. That's all. Okay, so we're just getting just tapping a little blood.
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection out as you can.
Firmly grasp it. Let's just squeeze it. Squeeze it. Ooh, that looks satisfying and disgusting at the same time. There you go.
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe.
Fennel acid?
When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Oh my, just the sound and everything. Not too good.
Finish by applying some antibiotic ointment on a sterile gauze pad.
Nice. Okay. I mean, yeah, that's understandable.
Place it against the toe and wrap it in a gauze bandage.
Very nice.
Fantastic job. Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day.
Yep.
While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper-fitting shoes, properly trimming his toenails, and keeping his feet clean and dry.
You see?
And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
What is how to cook a turkey? What does that have to do with anything with surgery? What? How to cook a turkey? Okay, yeah, but see what happens when you don't take care of your nails? That's what happens. They're gonna freaking cut that thing open and rip it out, squeeze out the pus, and just, I don't know, fix it up. And then once it heals, it's gonna be looking all weird and just, it's like the skin's gonna grow in a certain way and the nail's gonna be just like that now. So it's kind of your own fault I mean, you know, sometimes you can't help it, but you know, that's just the way it is. So take care of your feet. Take care of your nails, especially if your feet is the main precaution. I don't think these nails ever really get, do they? I don't know. I don't think they do. Okay, so next surgery we're gonna do, because since I was thinking about, you know, like the worst surgeries possible, you have the feet or the nails, and getting ingrown nails. So now we're gonna try this one right here, which is the eyes. There you go. Before you screw up, we're gonna do some LASIK eye surgery. Ooh, this is gonna be fascinating. Can't wait for that. I mean, the only other thing I could think of would be like some like regular wounds, but regular wounds everyone has.
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses.
Exactly.
LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam.
These are my glasses,
her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery.
I can't see.
We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes?
Yeah, just give me 1 second. I was just showing off my glasses. I would be wearing these right now, but unfortunately I have contacts on, because, you know, contacts are better. And I actually have 2 stigmatisms in my eyes, so it's like, I have 2 stigmatisms, and my doctor was actually saying something about that. He was like, hey, you should get LASIK eye surgery. I'm like, you're funny. I'll think about that later. Don't think laser eye surgeries. I mean, it depends. It depends. Like, I'm not really that afraid to get laser eye surgeries. It's just that there's just so much. I've heard so many different stories about laser eye surgeries not working and just screwing up people's eyes. Just go ahead and numb them. Like, when it comes to the eyes...
Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain.
Yep.
Debris can complicate the procedure, so we need to make sure that the area around the eye is clean. Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide.
In other words,
so let's get that speculum over the eye.
In other words, a brainwashing tool. When you can't close your eyes, they put that thing there, so you're like, your eyes are just stuck.
If the patient was allowed to blink, we might cut or burn the wrong area.
Ouch.
At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap.
Yeah.
Now we place a suction ring over the eye.
Suction ring? That's right, yeah. I've seen this on YouTube too, where they actually do the thing. It looks freaking crazy.
The ring sucks the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached.
Yep.
For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
We're just gonna go whooshing, and take like or you can just take a knife and go whoosh, like that with your eye. Just a little slice here, little slice. Yeah, just here we go. Oh, you can see it move. Oh, here we go. Whooshing. That is.
With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea.
Very nice. Let's go into it. Oh, wait. What? I thought, what? Huh, click and drag.
This is the part we'll reshape with a laser.
Okay.
The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds.
Yep.
The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair. And that's it. Please fold the corneal flap back into the original position, making sure our ink guides match up.
Yeah, basically you're ripping, or you're not ripping, you're cutting the cornea or the whatever the heck it is, the cap back, and then you're burning off like the improper shape, making a proper shape so that when you put it back and it heals, the light or whatever reflects off will actually reflect off perfectly, and then you can see perfectly. Because basically, if for people who have 20/20 vision, like for example me, I don't have 20/20 vision. Everything's just
Nicely
blurry.
done.
So
while you were working, I went ahead and took care of the other eye. We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely.
it's still funny looking.
And there you have it, another successful surgery.
Nice.
You can see more of my superior surgical technique and my other procedures here on surgerysquad.com.
Virtual dental filling. There's so many different things you can do, especially with like teeth and stuff like that. Teeth and like there's also like just different cuts and like lacerations that you can fix up and heal and everything like that. So this is a cool website. It's a cool website. It actually shows a lots of different interesting things that, you know, if you're curious to know how they fix you up, or if, I don't know, like they do certain procedures and surgeries on you. It's a great website to look up and just to see exactly how they do it. Or you can just look up YouTube, because YouTube has like freaking everything. Honestly, I've seen so many different like surgery stuff on YouTube that's like it's interesting. I mean, I find it pretty interesting. I don't really find it all that squeamish. And honestly, I'm like, only certain things freak me out a little bit, but like, honestly, it's more interesting than anything to me. Like, I can handle the squeamishness because I'm more interested in it. So that's pretty much it for this episode of surgery. If you want to see more, please let me know. And you know, that's pretty much it. So thank you guys so much for watching this. Let's see you all next time. Goodbye, everyone. Goodbye.